Hello doctors, welcome back to ASAN network, and this is your fracture classification series. I am your Dr.Salauddin, and let's continue with our next classification, that is the subtrochanteric fracture classification. So the subtrochanteric fracture classification is in the time-based evolution. The first classification dates back to 1964, where first was given by Fielding. Then Seinsheimer gave the second subtrochanteric classification, and then Russell and Taylor gave the third classification, and the latest classification was given by modified AO classification. So Fielding's and Seinsheimer's, these all classifications, the concept of classification is whether the fracture is from the level of lesser trochanter. It is for Fielding. Fielding classifies based on the fracture, whether it is at what level from the lesser trochanter. Seinsheimer classified based on the number of fragments of the subtrochanteric fracture. Then Russell and Taylor classified the subtrochanteric fracture based on the involvement of the piriformis fossa. Then finally the AO or the OTA classification based on the fracture morphology, they classified it. The clinical value of these classifications is that Fielding's is just a descriptive and an anatomical type of classification. Then Seinsheimer is a stability predictor, so it can be used clinically for stability prediction. And then for the implant of choice, we use the Russell and Taylor classification. This is the most commonly used classification. The Russell and Taylor is the most commonly used classification nowadays for choosing the implant, right type of implant for the subtrochanteric fracture. Then the AO is an universal coding system for universal discussion in the panels. Next, why it's important? The subtrochanteric fracture, why it is important is it's as a regular fracture, but the only difficulty comes for reducing the fracture because the iliopsoas muscle, this is the iliopsoas muscle, it attaches to the lesser trochanter, and these are the short external rotators. The iliopsoas will cause the flexion of the fragment, the flexion of the proximal fragment, and the short external rotators will cause external rotation of the proximal fragment. So the proximal fragment is in flexion and external rotation. That is why the difficulty of reducing the fracture, and hence the importance. We will discuss how to reduce the through the intraoperative videos, how to reduce an subtrochanteric fracture. In this video only we will be discussing the classification of the subtrochanteric fracture. So the first type, the Fielding's type, is based on the level of fracture at the lesser trochanter. So within 2.5 centimeters below the lesser trochanter, that is within 2.5 centimeters, it is type 1. From the lesser trochanter, if it is 2.5 to 5 centimeters, it is type 2. And from the lesser trochanter, if it is 5 to 7.5 centimeters, then it is type 3 of Fielding's classification. It is just a descriptive type of classification. Now it's not been in use and it's been absolute till date. Coming to Seinsheimer's classification, it's based on the number of fragments and stability. For stability prediction, Seinsheimer classification is used. So type 1 is simply undisplaced fracture, less than 2 mm of displacement, it is an undisplaced type 1. In type 2, there are two types. It is a simple two-part fragment. Type 1 is undisplaced, type 2 is two parts, and the fracture is transverse in type 2A. In type 2B, it is oblique, and it is spiral in type C. Okay, this is transverse, oblique and spiral two-part fracture in type 2. Type 3, it is 3 fragments, and the third fragment being the lesser trochanter in type A. If it is lesser trochanter in type A, it is type 3A. If the third fragment is an butterfly fragment, it is type 3B. So lesser trochanter as the third fragment, it is 3A. Butterfly fragment as the third fragment, it is 3B. Then if it is more than 3 fragments, it's an comminuted type and it is an type 4. And fifth type is same as the Boyd and Griffiths type 4, that is subtrochanteric fracture with an intertrochanteric extension. Here is the subtrochanteric and it's an extending into the intertrochanteric area. It is similar to the Boyd and Griffiths type 4. So this is the Seinsheimer's classification based on the fragments. Next, we will be dealing about the Russell and Taylor classification, where based on the involvement of the piriformis fossa and the intertrochanteric extension, he classifies the fractures. So type 1 is fracture, it does not involve the piriformis fossa, and type 2 it does involve the piriformis fossa. There are only two types, type 1 and type 2 in Russell and Taylor. In type 1 there is 1A, 1B. 1A, if the fracture extends below the lesser trochanter, it is below the lesser trochanter, then it is type 1A. If it involves the lesser trochanter, it is 1B. And type 2B, the fracture has stable medial buttress. The spelling is mistake here. The stable medial buttress, then it is 2A. Type 2B is an unstable medial buttress. We'll understand better in the image. See. So type 1, where it does not involve the piriformis fossa. This is the piriformis fossa here. So it is not involving the piriformis fossa. Type 1A is, it is below the lesser trochanter. The fracture is below the lesser trochanter. It is type 1A. If it involves the lesser trochanter, it is 1B. Then type 2 is, it involves the piriformis fossa. So it involving the piriformis fossa. Fracture is involving the piriformis fossa. Then it is type 2A with a stable medial buttress. See, type 2A is with a stable medial buttress. It's nothing but the medial cortex, it has to be preserved. If the medial cortex is preserved, then it is an stable medial buttress type 2A. If the medial cortex is involved and fractured, then it is type 2B. It's an unstable medial buttress. It is type 2B of Russell and Taylor's. So next, coming to the AO and ATO classification. The AO classification, as we have discussed, it's an alphanumerical classification. So 3 is for the femur, 2 is for the shaft, and within the shaft ABC is for the different types of the fracture. So in AO classification, he has not given specifically for subtrochanteric fracture. He includes the diaphyseal fracture, that is the femur shaft fracture, and the subtrochanteric fracture into single type of fracture. So femur shaft and subtrochanteric fractures are one in AO classification. Okay, so 3-2 is the classification for both subtrochanteric and femur shaft fracture in AO. So what are the types in the AO classification? That is 3-2A, B and C. 3-2A is simple fracture, B is wedge, and C is multifragmentary. So what are the types in that? A1, A2, A3, B1, B2, B3, C1, C2, C3. In A, it is a simple fracture. It could be a spiral, oblique, or a transverse fracture. Then in B, if the wedge is intact or fragmentary, or if it's a bending wedge. Then type C is multifragmentary, where there is a complex spiral or segmental or an irregular multifragmentary fracture. It is a type C3. Okay. So coming to the images. So coming to 3-2A1, where it's a simple spiral fracture. See, it's a simple spiral fracture. If it is more than 30 degrees, the fracture line is making more than 30 degrees with the horizontal. If it is making more than 30 degrees with the horizontal, then it's a oblique. If it is making less than 30 degrees with the horizontal, it is an transverse fracture. Okay. Then 3-2B, where it's an wedge. If the wedge is intact, it is B2. Wedge is intact, B2. If the wedge is fragmented, it is B3. 3-B3. Then 3-C is a multifragmentary fracture where thus it's an intact segmental fracture. There are more fractures, 2 consecutive fractures in the same bone. It's an intact segmental fracture. It is C2. So whenever you see a segmental fracture of femur shaft in your day-to-day clinics, you have to number it as 3-C2 according to AO classification. Then if it's an multifragmentary segmental, it is 3-C3 type of fracture in according to AO. In this, there is also some modifiers or qualifications, that is you give IJK, that is I is for proximal diaphyseal metaphyseal fracture. Same type of fractures, all the above classifications, same type of fractures, if it is occurring at the proximal end of the shaft, then it is I. If it is purely diaphyseal, that is mid diaphyseal, you gave it as J. If it is distal diaphyseal, then you give it as K. I, J, K is for proximal, mid and distal in the femur shaft. Okay. And there is a named classification, that is Winquist and Hansen classification, which is most commonly used for the femur shaft. It is based on the comminution of the femur fracture. So if there is no comminution, simple fracture, it is type 0, and if it is type 1, it's having an butterfly fragment. If it's an insignificant butterfly fragment, that too a small butterfly fragment, it is type 1. A large butterfly fragment, it is type 2, a large butterfly fragment. How do you decide if it is a large butterfly fragment? It is if it is having less than 50% of the cortical contact, less than 50% of cortical fragment contact both proximally and distally, then it is large butterfly fragment. Extensive comminution, and if there is more than 50% of the cortical loss, there is more cortical loss, more than 50%, it is lost. Okay, then it is type 3. Then finally segmental comminution with no cortical contact, all the pieces have broken and separated with no cortical contact, it give it as type 4. Okay, segmental comminution with no cortical contact, you give it as type 4 of the Winquist and Hansen classification of femur shaft. So this is the classification for subtrochanteric and femur shaft fractures. For more classifications, you go and hit the playlist button, and in the playlist you can see all the other bone classifications. Okay, it takes a lot of time for preparing the PPTs, adding all the images and recording, and again editing all the videos. So please encourage me by liking and subscribing this video, and do share with your colleagues, and be confident in your clinical rounds.